Welcome everyone to Mary Center's virtual town hall. I am Heather Morgan, Chief Development Officer, and I'm delighted to have you join us for this very special gathering. We're extremely grateful to have you here today and helping to make Mary Center part of your day today. Before we start our official program, I have just a few housekeeping items to share. Today's town hall will include a 15-minute question and answer session. Thank you to those of you who have submitted questions in advance during the registration process. But if you did not get a chance to submit a question in advance of today, not to worry. We're still going to be able to accept questions through our chat feature. And you can submit them through the chat feature, which you can find on the Zoom bottom menu bar. Your questions will be routed to my colleague, Sarah, and she will help manage the question flow. So during the question and answer portion of the program, Sarah will read the questions aloud for everyone to know what is being asked. And out of respect for everyone's time, we plan to end promptly at 10:15 today. We'll try to respond to as many questions as possible within the time we have available. And if there are questions that we don't get to due to time constraints, we'll be in touch with you directly. We don't want any questions to go unanswered. Also, please note today's session is being recorded and we will make the recording available to all next week. Now, let's get on with it. I'm very excited to introduce our new CEO, Dr. Tollie Elliott, along with our Executive Vice President of Medicine, Dr. Christian Cornejo. Dr. Elliott may be our new CEO, but he's certainly not new to Mary Center, having served in the role of Mary Center's Chief Medical Officer for 7 years prior. And prior to joining Mary Center, Dr. Elliott worked at Providence Hospital in Washington, D.C., where he was a staff physician and co-chair of the OB/GYN department in 2014. He also served as an associate professor at Howard University Hospital. Dr. Elliott was recognized as a Washingtonian top doctor in 2016. And my colleague, Dr. Cornejo, is a board-certified pediatrician and a fellow of the American Academy of Pediatrics. For over 15 years, Dr. Cornejo has committed his career to providing high-quality health care. Dr. Cornejo joined Mary Center in 2009 and has held the roles of Medical Director, Chief Medical Officer, and Senior Administrative Medical Director. Prior to his work at Mary Center, Dr. Cornejo was a clinical assistant professor of pediatrics at Georgetown University Medical Center and a pediatric and family practice resident preceptor at both Virginia Hospital Center and Inova Fairfax. Mary Center and our communities are so fortunate to have such talent helping to guide our mission and lead our work. I'll let you take it from here, Dr. Elliott and Dr. Cornejo.
Thanks, Heather. Whenever you read the background bio of the staff here, I feel very humbled because it's just like I'm around a lot of extremely talented providers, physicians, nurse practitioners, midwives, nurses, medical assistants, dental assistants, dentists, hygienists, licensed clinical social workers, psychologists, psychiatrists, and the wonderful staff that's here. I think that the one thing that's never really stated is that I was able to convince Dr. Cornejo to come back to Mary Center. He had actually left, and he was going to be leaving the area, and so he had reached out to me, and I was extremely fortunate to actually have him come back in, and it certainly made my job a lot easier because I had somebody that knew the model Mary Center, that understood our mission and our vision, and understood the values of the organization. And he took that head on as the senior medical director. And I would like to say that a lot of the success that we had as an organization, through the years upon his return and definitely through the pandemic definitely has Dr. Cornejo's name there. So thank you. We've talked about this and many of you on this call are familiar with us and some are new. So Mary Center was established in 1988 to care for Latin American immigrants. Mary Center now serves a broader community. We're entering into our 34th year with over 60,000 participants. I hate reading from slides, but these are facted, bullet points. So it's a lot easier for me to just state it really quick. But over 60,000 participants from 50 plus countries. We have 5 full service community health centers, 3 in the district, 2 in Maryland. 26 school-based mental health programs in the district, and 2 senior wellness centers that we work with the District of Columbia Department of Aging and Community Living, and then a public charter school, which is co-located at 3 health centers called BRIA. The social change model is very much impacted all of these facets that you see listed here. Dr. Cornejo, did you want to add anything more to your experience?
No, again, I'm very glad that, that I'm rejoined Mary Center, and I'm glad that you kind of convinced me to join. And as you said, Tol, I think one of the big things that we have at Mary Center is the staff, and we cannot do anything. We cannot serve the community around our clinics unless we have very high qualified staff. I just wanted to add that, but thank you.
Thank you. We'll go to the next slide. So we'd like to present a brief story, and I'll let the video speak for itself. This is about a Mary Center participant and a student at Smith College. A really wonderful story. Sarah?
Hi, my name is Michelle. I'm a DC resident, and I've been a participant with Mary Center ever since I was little. I think probably even since like I first started going to the doctor's office. And Mary Center has been very special for me and my family just because it hasn't been just solely like a medical service, but I think a lot of their mission and they fulfilled is that they give a lot of holistic help. And anytime there's a question with my mom about like, I guess just navigating the States and how to do something, she's been able to receive support from Mary Center. And I've also had that shared experience. I'm not sure how common this is within like doctor's offices, but I know when I would go do my yearly like annual check-ins, I would always have like a second part of the appointment would be to work with like the nutritionist, and we talk about like, I believe it was the nutritionist, we talk about like my life and how school going, what activities I'm doing, what clubs. And anytime I had that experience to be able to talk about my life outside of like medical things, it felt more sincere and holistic just because she would remember like, oh, this was the last thing I did. So when I was younger, my mother and I would go to Mary Center to make use of the BRIA services. And in particular, because I was younger than the age of going to preschool, I was younger than 4. I would go specifically here, and while I would be in classes like playing and learning, my mom would take English courses. And although I was very young and I don't have discrete, like very concrete memories of what happened, there are a lot of pictures in my house of those times, of those like classes, and my mom, how she would come and engage in the class and how she would also learn English. And that was really helpful for her, because coming to the States and I guess starting from scratch, because we didn't have family here, my mother and my father did dive into the workforce. And for my mother, this was really helpful because while she was able to still work, these classes were very accommodating and fit with her schedule, and she learned a lot of English. And I think that that's a very special opportunity that she had that not many places offer. So it was nice for me to able to go to school and her not to worry about those finances, and me be able to like interact with kids my age and be a part of BRIA, and for her to simultaneously also learn English.
All right, well, thank you, Sarah. So we are now in a pandemic, hasn't evaporated. We're still experiencing it. And I think that the story that both Dr. Cornejo and I are about to present to you in terms of the impact that Mary Center's had on the communities that we serve is pretty profound, both from a pediatric, adult, maternal health standpoint, from a social services perspective. There's a lot of impact that we've made there, and it's been something I would say that's unique, that contributed a lot towards staff retention. We've heard about the great resignation across the country, but I think that when you work in this kind of setting in a community health center that focuses on the social change model, it really does help people feel as though they're actually making a contribution towards not just people's lives, but actually towards making everything better in terms of the country. And I don't say that lightly, because a lot of the essential workers are the workers that we take care of and have the privilege to take care of for. So over the course of this journey, we've administered nearly 45,000 tests. 20% of the pregnant participants tested were positive for coronavirus. We had a little bit north of 250 women who were pregnant and positive for the coronavirus. Fortunately, we did not lose any. We are an outpatient provider. We don't do inpatient services to the profound nature that we're seeking to do yet. But we were very fortunate to be able to help these women navigate to a space that by the time they did come to the point of delivery, there were successful outcomes. And as stated, we administered over 26,500 vaccines. More than 200 vaccinations have been provided since March 1st. We know that the vaccine rate has gone down. The coronavirus and SARS-CoV-2 has not gone away. The most important thing is that we advocate that the vaccine will help save lives. Dr. Cornejo, would you like to add anything to that?
Yeah, I wanted to make the point that Mary Center has been, at least for pediatrics, the second in terms of the organization that gives vaccines. Mary Center has been the second biggest organization that has provided vaccines for pediatrics. The first one was Children's Hospital. And again, this is what we're trying to do to protect our patients, our families. So Mary Center has made a great impact, preventing severe disease with the vaccine.
Thank you. Can we go to the next slide, please? So how do we protect the community during the pandemic? Again, I would say that addressing vaccine hesitancy is that is something that we are very proud of. We've had many of our staff who provided videos in English, Spanish, and Amharic to the communities that were distributed widely. It was freely available. We certainly encouraged it and passed that on to DC Health, and I believe they even shared that with the community. We participated in multiple events in terms of staff speaking out at churches, speaking out at community events, and virtually certainly, to make sure that people understood that the vaccine was safe. You see the picture here. We were one of the first providers to start vaccinating children. There's the mayor and the director of DC Health, Dr. Nesbitt, who've been extremely strong supporters of Mary Center, and understanding that we all are working together to support the community. Understanding that there's new virus variants, we recognize that we have to pivot and we have to be nimble, and we have to recognize also that we need to screen at the door. We need to make sure that we promote mask wearing. We understand that they're talking about easy masks, but we're still a health center. And although we're not, we're not a place where somebody might go to the movies, we're a place where somebody's going for health. And even though people may walk through that door, they may have symptoms that are associated with it. And we are trying to mitigate and decrease the risk of getting not only transmitted to the participants that we serve, but also the staff. We want to make sure the staff is supported. And that goes to the physical and emotional well-being of our participants, because you have to have a healthy staff and you have to support the staff to make sure that the individuals walking through the door are treated with the utmost respect and the deserve that they, the care that they deserve, because it is an extreme privilege to treat them. Dr. Cornejo, would you like to say anything else?
Yeah, sometimes I like to use an analogy of a plane that is an emergency, right? First, you have to protect yourself, put a mask to you, and then to the person who is with you. And that's what actually we did from the beginning. And we started with PPEs, we started with face masks, face shields to protect the staff because they were valuable to what we were trying to do. To protect our patients. The questions that I have received regarding vaccine hesitance has changed since since COVID started. At the beginning, it was a lot of fear. They did it too fast, or they didn't follow all the protocol. It's new. I'm going to get COVID because I get a vaccine. As we have been able to continue educating our participants, our patients about the COVID vaccine, now the questions have pivoted towards, I already got the vaccine, now is this safe for my kid? My kid is what I love the most, and I don't want anything happening to them. The most important thing is that I told patients, I like to treat my patients like my family, and my parents, my family have received the vaccine, and that's what I'm recommending the vaccine. Once you share that once you tell them that it's safe and it's secure and is the most important tool that we have to protect ourselves, then it's easy for parents to make the best decision. Now, not everybody is ready, and we have to respect that. But I think the more information we provide, the better. And that has been very, very important. One of the things that we're looking for, as you all know, right now we have vaccines for kids more than 5. And very soon, hopefully, we will have the vaccines for those who cannot get vaccines right now. So one of the things that I share is also, you getting the vaccine can protect your kid who is younger, who is not available to get the vaccine. And also we share the fact that, getting the vaccine doesn't give the chance to the virus to mutate. And that will help us actually to be more protected. So we are always looking for the new variant. But again, we won't have as many of those unless we get vaccinated. Since the beginning of the pandemic, we definitely switched to more telemedicine, less appointments in the clinic. Now we are definitely going back to a little bit of the normalcy that we had before, definitely behind on physicals that we couldn't do, via telemedicine. So now we are kind of catching up on all these. And we are actually realizing that the pandemic has affected our patients, not only from the physical point of view, but emotionally, right? We are seeing a lot of patients who are anxious, depressed, without a job, and still having the same challenges of food insecurity, home insecurity, that we always have had, but now it's more, it's bigger. So we definitely need your help to continue doing, to continue helping our participants.
Thank you, and it's definitely more profound. The social services in a programmatic element of Mary Center sees that on a regular basis. And it's the essential workforce has been ravaged. I think that the pandemic has exposed a lot of what we at the ground level we're seeing on a regular basis, but it's made it quite obvious and blatant that the disparities in certain communities, although it exists in broad daylight, the pandemic brought it out and made it in everybody's face. I think the other thing to keep in mind is that we have not done this alone. We have done this with a partnership. It actually happened with working with DC Primary Care Association, working with other FQHCs in the District of Columbia and Maryland, working with Montgomery County, Prince George's County, the state of Maryland, and also the federal level. And so the work that we have been able to get through during this pandemic has been a team effort, working with the hospitals. And I think that the collaboration and working with the hospitals, both many across the district and in Maryland, it has been extremely valuable and necessary. And ultimately, I just want to touch upon the part that Dr. Cornejo mentioned. Telemedicine is here to stay. We are strong advocates of it. We recognize that we need to show how that makes sense, but we also recognize how individuals who are utilizing telemedicine need to also have broadband access. We need to be advocate in that space. We need to be advocate for the participants that we see. Can we go to the next slide? So we wanted to talk about pillars of our strategic plan and furthering Mary Center's impact and certainly elevating the mission in the communities that we're serving, ensuring long-term financial sustainability in a very difficult time, delivering the highest quality participant services and experiences, and attract and retain and engage the highest quality of staff. The mission has not changed. We understand leadership changes, we understand teams change, but the mission is always going to be there, the communities that we serve, the marginalized communities, the immigrant communities, minority communities, and still preaching the social change modeling and have an impact there. Long-term financial sustainability is highly relevant, especially during this moment in history. We see a lot of shifts occurring. We are looking at what's going to happen in the US economy. We're looking at what's going to happen in healthcare, the healthcare economy. And we want to make sure that with the near $8 million of healthcare services that we gave away last year to those individuals that could not afford care, that we too are in a position where we can support them. So all the support that we get is extremely valuable in terms of trying to make sure that we can care for these women. One point of fact is that at our Adelphi site, through 2020, there were moments where 80% of the pregnant women were uninsured. You can only imagine if we're living through the fear of the pandemic, you can only imagine the fear of what it's like to be pregnant during the pandemic and dealing with, housing security and under-resourced populations, and then dealing with the fact that what am I going to do? Where am I going to go? Who am I going to see? I would say that, as a clinic and as an organization, we never shut our doors during the pandemic. We remained open the entirety of that time. And one population we made absolutely certain that we were available for were women who were pregnant. And so, our long-term financial sustainability is more than just a business metric. It's actually a mission. It feeds into the mission and the purpose of why we're here every day. Highest quality of participant services and experiences. I would say that we have been very dogged in terms of advocating for the level of care and the quality of care. The care comes first, the participant, the patient comes first. We have education days. We have breakout meetings with our staff to make sure that we look at, how are we treating? Are we up to date with the current clinical standards? And we have a very, very strong data and outcomes department that makes sure that they keep us on our toes as to where we are and where our deficits are and where we can get stronger and how we can get better. Because we understand that it's one thing to see people as they come through the door. It's another thing to make sure that when they leave and when they're home, that they are actually better. It's not about the number of individuals we serve. It's also about the impact that we have on their lives. The Great Resignation has been well documented. It's been stated. I think many times people think a community health center is a place that has cinder block walls and has, lime green colors on the walls, but, you have to attract and retain and engage the highest quality of staff. We have individuals that working at Mary Center that have advanced degrees well beyond, the undergraduate and then the professional degrees. They're individuals that are committed to the social change model and committed to making an impact on people's lives. I think that there's something different and unique about what we do, that when you come in, you really feel like you're getting an opportunity to actually practice medicine in this space that is not looking at, do you have insurance? Do you not have insurance? We just want to make sure that we take care of you. We have individuals who have been longtime professors at universities that we have convinced to come here and they have stayed. We have individuals that have advanced degrees, masters in public health, masters in health administration, masters in business administration. And it is making an impact in terms of how we look at things, both strategically, but also look at things clinically and programmatically, from our social services to our educational component with BRIA. The partnerships that we have also contribute to any person when they walk through that door as a participant, they feel as though they're getting the highest quality of care from the highest quality staff. Dr. Cornejo, did you want to add anything to that?
Yeah, I would like to emphasize the quality of service that we have provided. Again, we have learned through telemedicine that there are a lot of things that can be done. I think, as you all know, Mary Center was doing telemedicine services before COVID. We were doing what we call facilitated telemedicine. A team from Mary Center who will go to the house of participants who would, for different reasons, weren't able to come to the clinic. Transportation, bed bound, people who couldn't leave their home. So we will deploy a group of people who actually will be at the houses of our patients with blood pressure cuffs, scales. The pandemic actually helped us to actually even provide more services, to the point that we were able to kind of deliver vaccines at the houses of our participants. So the service, actually, the quality of the services for these individuals actually increased because we were able to kind of do more things through telemedicine. The other things that we noticed with telemedicine is our behavioral health services. The no-show rate of our patients receiving mental health services actually decreased. Going to the clinic, especially when you are working, it usually is a barrier for this type of services. So we have been able to actually provide more services for mental health to our participants, thank you to telemedicine. So again, as you said, Tol, a lot of things that can be done through telemedicine, and we hope that that stays. It will stay. We just need to do advocacy to making sure that we are continue doing that.
Yeah, it makes sense. Thank you for bringing that up. We've been doing telemedicine since late 2016 to the early 2017. So fortunately, we were in a position when the pandemic hit that we pivoted hard into it. But what we found prior to the pandemic was that it was making an impact on re-engaging individuals into care, making sure that people come in for their pap smear, making sure that people come in for their vaccinations, making sure that people are compliant with their medications, whether or not it's behavioral health medications or medications associated with hypertension, diabetes, decreasing emergency department utilization. One thing I cannot understate is that, can't state more, I should say, is that our behavioral health team has done an absolutely incredible job of doing telebehavioral health. We were able to stay engaged. We understood that the pandemic hit many communities hard, in particular those living with substance use disorder. And so therefore, our integrated services with behavioral health and addiction services has been tremendous. It was still a devastating tragedy in terms of the number of individuals lost during the pandemic because of substance use. But still, anything that we could do to help made a difference, and telemedicine definitely made sure that we were there, present and available. Can we go to the next slide?
That's actually the last
Great.
slide, Dr. Elliott.
Because that gives us, what, 18 minutes for questions and answer now?
Yes, yes.
All right, good.
So I'll go ahead and start. We had some great questions submitted when folks registered, so I will go ahead and read the first question. What is Mary Center doing for newborn hearing screening and children hearing health in general? Could you please comment on child hearing health prevalence in the communities you serve?
I will take that one. So right now, as you may know, every newborn born here in the U.S. Gets a hearing test at the hospital. Actually, they don't allow the parents take the baby home unless the hearing test is done. One of the things that we do, we see newborns, quite often the first 2 years of life. Almost every 2 months we are seeing them for the weight checks and their vaccines and so forth. So one of the things that we, as providers, definitely make sure is that we get the newborn screen, the newborn discharge summary that usually has the results of the hearing test. So we constantly do the first 6 months, 12 months of life. The first visits, we make sure that the hearing test was done. If it was not done, unfortunately, it requires a special machine that we don't have at Mary Center. But as soon as we identify a newborn who didn't pass the hearing test, we refer them immediately to clinics where they can do the hearing test. The prevalence, I have a few patients whose parents are deaf. So we always are watching for signs of death in the kids. And we immediately, as we notice, the parents say, my kid doesn't turn, her face when I'm talking to him. We immediately kind of send a referral for that. I'm not sure if I think I'm answering the question, but.
Yeah, I think definitely you did. Dr. Elliott, did you have anything to add, or?
He's a pediatrician, so I'm gonna.
Okay, no problem.
I'm gonna let the subject matter expert take the lead on that one.
Okay, great. I think Dr. Cornejo did a great job of answering it. So another question we received is, does Mary Center still provide services to a large number of uninsured individuals?
Yes, roughly 20% of our patients are uninsured. 70% are Medicaid, 10%, these are rough numbers, 70% Medicaid, 10% private, and roughly 20% uninsured.
Awesome. Okay, and then the next question is, what are Mary Center's strategic expansion and/or physical space redevelopment plans for the next 3 to 5 years?
Yeah, that's a great question. The most important thing is that, any sort of growth on that level has to go through a very deliberate process of making sure that you're being fiscally responsible and not overreaching your bounds, where you find yourself in the negative and in the red. There's an intense desire from both the staff and members of the community for Mary Center to continue to grow in certain markets and certain areas. It's not for a lack of desire, but it's something that takes time. And to do something like that also requires an absolutely wonderful board to understand and recognize that need as well. These things require board approval. We're constantly seeking, consult and counsel from them. It's a very diverse board. More than half of the board are patients and participants at Mary Center. But in terms of strategic expansion, we've had requests to look at what's happening in parts of Montgomery County and parts of the district and in parts of Prince George's County. These are things that we are constantly exploring. I can't give anything that's concrete right now, but it is something that has long been a desire of both the participants and staff.
Yeah, if I can add to that, Toll, again, having a Mary Center for 13 years, and always Mary Center has responded to the needs of the participants. Of course, we cannot do everything under one roof, but we like to think that we can do as much as we can. So when we think about these type of decisions, we definitely pay attention to what our participants need. And in a very well-developed strategic way, we jump into opportunities that sometimes they just show themselves.
Wonderful, thank you. Another question we have received is, could you share which hospitals we are currently working with?
Howard University Hospital, White Oak Medical Center, Sibley Memorial. Those are the first three that come to mind. We have a lot of patients that go to all those hospitals, but I would say that those three hospitals are the ones that we have a pretty robust relationship in terms of patient engagement and also activity. And one of the things that's interesting about that question is that we have we're working on a relationship with currently we have something with Howard University College of Dentistry and Delta Dental and Senior Oral Health. We're looking at a relationship with Howard and Maternal Health. We have a relationship with White Oak Medical Center and Maternal Health. Adventist Health is now part of the management structure for Howard and White Oak Medical Center. Sibley Hospital has reached out to us, and we're very grateful for that as well in terms of their maternity services. And so we're constantly seeking on how to provide a broader scope and level of access to all of our participants so that we don't find ourselves where there's just one hospital. Tragically, we had a very, very strong relationship with Providence, but when that hospital shut down, it left us in a position where it was really difficult for us to kind of support the participants that we had and the patients that we had. And so we're trying to make it much more strategic and broad so that the patients have options, but also that we can contribute towards doing delivery services and other aspects of care.
Okay, thank you so much. We are getting so many great questions. The next question is, the Prince George's County Public School Board of Education members are committed to increasing vaccination rates. We had expected the public health departments to recommend a vaccine mandate, but that did not happen. What is your advice to the Prince George's County Public School today to increase rates? I'm thinking about education and operational decisions around clinic delivery.
Yeah, that's a great question, but it's a difficult one because there's so many nuances to the decisions that are made at the administrative level for Prince George's County Public Schools. We, as a partner, can contribute our voice to the table and say, how can we help? Where can we be? We certainly think that vaccines work. We think that vaccines help, but there are strategic decisions that jurisdictions make that are beyond the scope of the information that we have. And so it's our job to provide a voice and advocate for it. I don't know if Dr. Cornejo wanted to add anything beyond that.
Yeah, especially in PG County, actually, since for the last 5 years, actually, we have partnered and we are actually a place where participants or patients who are not Mary Center patients can get vaccines. I mean, we encourage them to get a medical home, but we have people who can get vaccines from PG County if they need it for the school. I mean, the relationship is still strong, and it's not unusual that sometimes we get requests. In this case, not from PG County, but recently we got a request from Montgomery County because, again, they are trying to make sure the students get their vaccines. So we're exploring a possibility to actually work with Montgomery County for that. PG County hasn't reached out to us, but again, we continue this partnership and providing vaccines to participants or students who are not Mary Center patients continuously. So.
We did a lot of, and correct me if I'm wrong, we actually were a space where a lot of international students that came into Prince George's County when they were unattached, we did their vaccines too for PG County. So there's definitely, even though they didn't reach out directly like Dr. Cornejo said, there's definitely a relationship that's already established where they know that they can engage Mary Center for vaccines.
Great. Okay. Next question, beyond your two wellness centers, your two senior wellness centers, does Mary Center have any plans to expand its services for older adults? Great question.
I'm smiling because I think it must have been maybe 4 years ago, we had a committee that sprouted out called the IDEA Committee, and stands for Inclusion, Diversity, Equity, and Awareness. And it was something that the staff were very much behind. And this IDEA Committee has subcommittees. There's a racial equity subcommittee, there's a disability subcommittee, there is a LGBTQ subcommittee, and then there is a senior wellness or older adult subcommittee. And so it is multifaceted. There's multiple staff members that participate. It's not just clinicians, it's from across the organization. And there's a strong desire to increase our capacity to provide services, both from a programmatic social space like the wellness centers, but also from a clinical space. So we have brought on a physician just recently last year, I think it was late last year, who is fellowship trained in geriatrics, and we're recognizing that that's a space that we need to embrace, and we need to embrace it not just from a geriatrics medicine perspective, but from a overall perspective of total health and wellness. And so it's kind of a great partnership, and this includes nutrition. This includes, programmatic components with the senior wellness centers, and so it's definitely a space that we are running toward, not running away from, and we're trying to make sure we expand on.
And that has been an evolution. So I mean, after 34 years in the community, those who were 30 years old 30 years ago, now they are getting into the seniors year. So again, it speaks to how Mary Center responds to the need of our participants. Older, with different needs, with different expectations. So again, we're very happy that we hire a provider who is now kind of the person who is helping us lead and helping us understand the needs that this population needs. So.
And if I can just weigh in, I just wanted to add that we also have a senior nutrition program that we're working with the DC's Department of I can't remember, the older adults and aging, but we have a senior nutrition program that has helped bring food delivery boxes to seniors, especially during the pandemic. It launched in September 2020. I believe we have delivered over 8,000 boxes in the last year. And I can send you more information, Howard. I see that, I know that's a particular interest of yours, so I can definitely send you an email about that program as well. Moving on to the next question. Can you please describe the relationship with BRIA and if it's evolving? That's the question.
Yeah, so it's always evolving. And, the funny thing is, internally, we never feel like we collaborate enough. I like to call BRIA our Siamese twin. We are attached at the hip, and with the with the early childhood education and the adult education, in particular with English literacy and computer learning, as well as the medical assistant training and the early childhood development training program, it gives an opportunity for both participants, young and older, as parents, to definitely have that collaboration with Mary Center. I think that one of the areas that we're definitely looking at is we're looking at how can we take this information, this experience that we've had for the past several decades to grow on this and report back, and how that effectuates change in terms of policy change, in terms of payment reform. And so I think that that's the biggest opportunity that we're looking at right now. And so we're looking at how to strengthen this from a data-driven perspective to show how this just makes sense in a social change model.
Perfect. Dr. Cornejo, Dr. Elliott summed it up, right? Okay. All right. We have another question, and it asks, how did Mary Center launch telemedicine? Did you contract with a vendor or develop this service internally? And did you need to hire additional staff?
I'm smiling about that because I remember when this started. We were approached by AmeriHealth, Caritas DC, who said, hey, you know, can you come up with a strategy to like approach high cost, high utilizer individuals in the system, telemedicine, something, anything. And so we had a model that started off with the an innovation challenge through CMS. I think it was way back in like 2014 or something. And part of that was what is called a CSIN, it's Connected Care Integrated Network. And that, as it came to a sunset, there were a number of devices that were being used. The whole purpose was to be able to meet people where they are. And so we took that and we stripped it down. We recognized that doing it the way it initially had been designed wasn't going to be extremely efficient for the physician and for the healthcare provider doing it. And so we took those devices, we took the software systems and the hardware systems, and we created our own model of what we called facilitated, we just called it telemedicine. And it was when the pandemic came that when everybody said, oh, telemedicine, that people were going virtual, they were using their smart devices, they were doing that. We recognized, wait a second, we have this model of telemedicine, but it's not the same. So we decided to call it facilitated telemedicine. And it was something that in the design phase was 2016, the implementation phase, I believe, was like late March, early April 2017. And it involved training a medical assistant who was trained in phlebotomy, who was also taught on how to use the equipment and the devices, giving them a hotspot, giving them a laptop that was going to enable them to give high quality video. And they would actually go to the home and they would get the blood pressure. They had a digital stethoscope, they had a scale, they had a magnifying lens so you could see in the ear. We did not do an ophthalmic exam like an eye exam, that's too technical. They also were assessing the individual's home to make sure that there were no fall risks, to make sure that there was no food insecurity, to make sure that it was a stable environment. And the provider, just like us right now, we're sitting in the office. And so we literally had, you know, if I as a physician, OBGYN, am seeing, you know, Miss Cornejo in room 2. Then after I saw her in room 2, I would go to room 3 and I'd fire up the laptop and there would be the patient waiting right for me with the medical assistant at the home. So we called them the telemedical MA. That actually started off focusing on adults, and then it went into focusing on kids. And then just towards the end of 2019 into 2020, we were looking at pregnant women. And so if you look at it, it's element of risk that's decreasing. And the risk actually goes up as you start going from adults to pregnant women. And so we wanted to make absolutely certain that we were doing this in a safe space. We were doing this deliberately. We were following and coming up with guidelines that were, as it was evolving, we were looking at American Telemedical Association guidelines. We were looking at things that just made sense for us as providers. But at the same time, we had to state that this is a tool. This is not a panacea. This isn't going to solve all ills. And it's supposed to be a tool that any healthcare provider can use and say, hey, this is a good candidate for telemedicine services. And so we even got to the point where, as we interviewed people, we did not interview anyone unless they were comfortable doing telemedicine. I mean, they just weren't going to get hired. And so I could talk a long time about telemedicine. That's something that's very close to my heart, because I was with that from the beginning. But we did not contract out. We didn't hire a vendor for anything. If anything, we found more efficient ways, and we started using resources that we had internally.
Yeah, and if I can add to that, again, this has been an evolution. I mean, we were doing it before COVID. It just increased dramatically during COVID. And as we explore, again, other opportunities, we also realized the need, especially during the COVID, those urgent care needs, patients who, I have a fever, but I'm feeling well, I want to make sure I'm okay. So last year we started a pilot with urgent telemedicine providers, just a provider who is only addressing urgent needs via telemedicine. And that's what we have right now. And we are actually thinking about expanding, because, what we have noticed is that type of service has decreased ER visits or being people in the hospital, because you can address a lot of needs via telemedicine. At the same time, this provider actually is very knowledgeable when this patient really needs to come to the clinic. Immediately, he contacts one of us saying, this patient needs to be in the clinic this afternoon. And we'll add that patient just to complete the evaluation that he did via telemedicine. And this is working very well, because otherwise the patient will go to the emergency room and utilize services that sometimes are not needed. So, I mean, we are very proud of doing that and thinking about expanding that service.
So the next phase is teledental. Sorry, Heather, I cut you off real quick, but we definitely want to explore teledental and see how we can make an impact on there. We want to reduce, we want people to be able to stay home and get the services they need without having to venture out and go to spaces that they really don't need to. And there could not be a better example of the pandemic, where they were telling people, don't go to the emergency room if you don't need to. And so telemedicine gives us the capacity to put people in those spaces where they can receive the care that's most effective for them.
Thank you. Thank you so much. And thank you for all the engagement this morning and the wonderful questions. We're out of time really, and we'll have to wrap up the Q&A portion of the event, but thank you for your questions. And please, we're here to answer any other thoughts and hear your ideas and questions. So please, we want to continue to hear from everyone. Feel free to reach out. I want to thank Dr. Elliott and Dr. Cornejo for your time this morning. And of course, I want to thank each of you for joining us today, our audience. We so appreciate your spending part of your morning with us today. And moreover, we're super grateful to all of you for the incredible support throughout this public health crisis. It's really because of our dedicated supporters that we can stay in this fight against the virus and help keep our community members healthy. Thank you again for joining us, and enjoy the rest of your day today. Thanks.
Thank you. Thank you, and be safe, please.